What condition is
Hello
seen?
guys, good evening. Today we are going to discuss about leprosy. So suppose if a man aged 40 years or 45 years came to the OPD with the skin uh, lesions and loss of sensation in that place means uh, in that place and granuloma formation is there and loss of sensation is there at that place and hair loss is seen at that place. So he came to OPD with this disorder. Then what is the possible diagnosis? It is leprosy, guys. So today we are going to learn about leprosy. Previously leprosy patients usually isolated and some means they used to treat them very cruelly. They used to treat the leprosy patients, but leprosy only infects when there is a continued contact with the person for several months. Okay, so it is not easily spreaded. Okay, what is a causative agent? Mycobacterium leprae. So we will use gene lesion stain like that of Mycobacterium tuberculosis, but we will use 5% of H2SO4 to this. Okay. And Shepherd man, he cultivated leprae bacilli, the food pads of mice at the lower temperature of 20 degrees C. Normally, leprae bacilli do not have any culture media to grow. Okay, so he is the first person who cultured it in the food pads of the mice. Okay, it is a social stigma. It is a chronic granulomatous disease. Okay, ulcer formation is there, and pus filled lesions will be there, and it is somewhat shiny lesions. There is less pigmentation at that area, and we'll see first loss of pain, touch, and temperature at that lesion, and it only involves the peripheral parts of the body. Central parts are not involved. CNS and lungs are not involved. CNS and not the upper part of lung is involved, means up to the bifurcation of trachea it is involved, but below the bifurcation it is not involved. Okay, it is capable of affecting the other tissues or organs, and it will cause some deformities. Okay, so we should treat leprosy patient. Okay, it has long incubation period. Incubation means the period since the person got infected and the appearance of symptoms. This middle period is known as incubation period. Leprosy has a long incubation period, means 5 to 7 years it will take. Okay, it has long generation time. What is generation time? If bacteria the time taken by the bacteria to replicate is or to duplicate is known as generation time, to duplicate into 2. So normally it will take 12 to 13 days it is taking, means it is a long generation time. Some like yeast it will take just 18 minutes, whereas tubercular bacilli it will take 20 hours, but this has long generation time. Okay, clinically how we will classify means a paucibacillary leprosy and multibacillary leprosy. You can easily understand. Pauci means a very small number of bacilli are present. Multibacillary, multiple many bacilli which are present. Okay, so another classification is lepromatous, like lepromatous leprosy, borderline leprosy, and like tubercular leprosy. Okay, uh, and another one according to the different organizations like Ridley Joplin's classification, Midget's classification, and Indian classification. And according to this paucibacillary leprosy, we will see a small number of bacilli, right? They can't be usually seen, okay, in the peripheral smear, but multibacillary leprosy can be identified because there are so many number of bacilli are there, right? Multiple lesions will be seen multibacillary. Okay, so modern this is the classification. Okay, as you see guys, this is classification: lepromatous type, lepromatous, borderline lepromatous, borderline lepromatous, and borderline tuberculoid leprosy. Medic's classification, lepromatous type, borderline indeterminate type, tuberculoid type. Indian classification, lepromatous type, borderline indeterminate type, pureuretic type, and tuberculoid type. Okay guys, let's see this. And we have to know the differences between tuberculoid leprosy and lepromatous leprosy. And guys, lepromin test, did you hear? So lepromin test only reveals tuberculoid leprosy, it won't reveal the lepromatous leprosy. Okay, and by significant nerve lesions we will find whether it is lepromatous leprosy or tuberculoid leprosy. Means late hyposthesia. What is hyposthesia? Means loss of sensations mildly. Okay, it is a late sign. Okay, variable nerve process will be involved. Here in tuberculoid leprosy, it is early anesthetic skin lesion. Means if the skin lesion appears and immediate loss of sensation will be seen at that place. Okay, it is early sign. Anesthesia sign is earlier. So cell mediated immunity is low in lepromatous leprosy. If it is low, means uh, there is chance of getting easily infected by lepromatous leprosy. Means cell mediated immunity low persons or low patients will get easily lepromatous leprosy, whereas normal cell mediated immunity persons will get affected with tuberculoid leprosy. And humoral immunity is exaggerated in case of lepromatous, whereas it is normal in case of tuberculoid leprosy. Macrophages means epithelioid type, which is in the tuberculoid leprosy, whereas a foamy type of macrophages, lipid-laden macrophages, will be seen in the lepromatous leprosy. Okay. Multibacillary is lepromatous leprosy, paucibacillary is tuberculoid leprosy. There are differences, and other types will be pure neurotic type. Okay. Motion peripheral nerves will be involved. Only bacilli, only bacteria that is directly infecting the nerves is only the leprosy bacteria. Okay, ulnar nerve thickenings, all nerve thickenings except medial popliteal nerve. Okay, remaining nerves are all involved. Okay, what are the complications? Complications are deformities and lepre reactions. Deformities, why the deformities are occurring? Due to the nerve injury, maybe disease progress. It will reveal disease progress. There is any injection or injury. Faces are leonine faces, sagging face. Eyebrows will be lost. There is a hair loss, we said. Alopecia is seen. Saddle nose. Corneal and opacity, ulcers will be seen. Hands will be like claw hand and wrist drop. Claw hand, where we will see, guys? In ulnar nerve lesions we will see usually claw hand. So there is claw hand and wrist drop even it is seen. Okay, lepre reactions are two types. One is type 1 and type 2. Type 1 is type 4 hypersensitivity. Type 2 is type 3 hypersensitivity reaction. Type 1 is borderline leprosy, whereas type 2 is lepromatous leprosy. Inflammation of previous lesions, new skin lesions as neuritis will be seen in the type 1, whereas papules will be seen in the type 2. Okay. These are the major. Th1 response is predominance in type 1, as Th predominance leading to the release of, here also Th1, but release of interleukin 6 and interleukin 8, TNF alpha. But in type 1 it is interferon gamma and interleukin 2. You should give glucocorticoids. Here in type 2 you should give glucocorticoids and thalidomide. Thalidomide, which is important teratogenic drug, so we should be careful in using it in pregnancy. Okay, be careful guys. Okay, what is the epidemiology? How means we will be learning about source of infection, mode of transmission, communicability, and environmental factors. Okay, this will come under the epidemiology. What is the laboratory diagnosis? We will do peripheral smear microscopy, and specimen collections. 6 specimens should be collected. Means 4 from the skin, means from forehead, cheek, chin, and buttock. 1 from the earlobe, nasal mucosa by nasal blow, and or scraping. All systemic examination should be done, guys. If any part is missing, it will be like we can't say which area is affected by leprosy. Okay, if we suspect one skin lesion also, we should able to see whether the skin lesions are present at any other place or not. Okay, appearance will be, it is less acid fast, so 5% H2SO4 for gel nasal staining. Cigar like bundles are seen. Okay, they will be bound together by lipid like substances, the glia. So globi will be formed. Globi present in the foamy macrophages. Foamy macrophages are seen in lepromatous leprosy. Okay, called, we will call these are viscous leprae cells or foamy cells. Live bacilli stain uniformly with parallel sides and rounded ends, whereas dead bacilli less uniformly stained. We already saw mouse foot pad cultivation, uh, which is favorable for the but it will take so many months, like 6 to 9 months it will be taken for growing the leprae bacilli in the food fats of the mice. Okay, not cultivable in artificial culture or in tissue culture, whereas remaining bacilli can be cultured. This is the specialty of leprae. Other animals, 9-banded amygdalo can also be used. Okay, advantages: 10 times more sensitive than microscopy, useful in detecting the drug resistance, evaluating potency of the drugs, and detects the viability of the bacilli. Disadvantages: time consuming, ethical issues, uses of animal because. Okay, ELISA should be done. ELISA IgM to detect the IgM antibodies to phospholipid 1. Okay, phenolic glycolipid 1, antigen of Mycobacterium leprae. Tests Mitsuda can be done, and type 4 hypersensitivity reaction against the leprae antigens. Okay, not useful for diagnosing active infection. What is the treatment? Multi-drug treatment should be given. Okay, 3-drug regimen: rifampicin, dapsone, and clofazimine should be given. For dapsone, 100 mg daily, self-administered. Rifampicin, 600 mg once in a month after supervision. Clofazimine, once in a month, so supervision is needed, by 50 mg daily, self-administered. Duration of treatment: 6 months of 6 months for paucibacillar leprosy, whereas 5 years for multibacillar leprosy. Follow-up should be done for 2 years. Okay, prevention: BCG vaccine, MIP vaccine. Chemoprophylaxis: dapsone should be given, which is effective and given to the high risk household contacts, to tuberculosis patients, not to lepromatous patients. Okay, for lepromatous patients we won't recommend the dapsone. Okay, hospitalized patients need not be isolated, and transmission requires prolonged contact. Okay guys, that's all for today. Thank you guys for patient listening to me. Okay, we'll do antibody detection also in this. Okay guys, thank you so much. Like this cigar bundle appearance is seen in microscopy.